So welcome to part 2 of my Place of Birth series. This is going to explore freestanding birth center birth and get into the benefits, the pros, the cons of freestanding birth centers. Let's talk about it. I want to keep saying freestanding birth center because what I'm referring to are places, locations to give birth that are entirely separate from a hospital. Over the last couple of years, many hospital labor and delivery units have changed their names to the birthing center, where I work included, does that. And these are just traditional L&D units with a fancy marketing brand name to call themselves a birth center, okay? They're traditional L&D units with the same policies, procedures, things available to them. They're not birth centers. When I say a freestanding birth center, I mean something separate from a hospital, an entirely separate building, separate staff, separate policies, separate ideologies for birth. That's what I'm talking about when I'm referring to freestanding birth centers. Something I want to add here is that there are a growing number of busy hospitals in America that are creating something called an alternative birth center or the natural birth center. Within their hospitals, where I work, we do have this. We have the traditional L&D, which is called the Family Birth Center. And then we have like an alternative birth center, which is named by the family that sponsored it, which is in the hospital, but it does have a separate set of policies and procedures. The rooms are very home-like. It does feel like a different environment, but still within the hospital setting. So those are great. They're great options. I'll have a separate video on kind of hospital-based birth centers. But for now, for the remainder of this section, I'm going to be talking about freestanding birth centers. When you go to a freestanding birth center, that's usually where you go for everything, okay? So all of your appointments are there, and that's where you get your blood drawn often. Only thing is ultrasounds, usually they have to send out to a hospital setting or a radiology, outpatient radiology place. But usually you go to the birth center for your visits. A birth center looks like a very home-like environment. It feels like you're in the living room when you're waiting in the lobby, and then, you know, you go into the exam room, which does often have an exam table, but it just has more of a home-like environment. Usually birth centers are run by midwives, either nurse midwives or certified professional midwives. If you're not sure about the distinction, please check out my What is a Midwife video. I talk all about that. Care you receive in a freestanding birth center is just totally different. There's still the routine prenatal labs and things that are offered to you, screening tests, ultrasounds, etc. However, it's often presented in more of a shared decision-making model where it's not like, this is what you need to do because this is what you do. It's, these are the options. You choose what works best for you. I think that in general happens with outside of hospital midwifery care, more so than anything else. Again, freestanding birth centers are located in a variety of places. I encourage you to check out your local, just Google to see if there's any near you. The American Association of Birth Centers, aabc.org, is a really good resource and website where you can look into accredited birth centers in your area. Usually, and especially to be accredited, freestanding birth centers have to be within a certain mile radius of a hospital in case of the need of emergency transfer. Often too, they have a relationship with the local hospital, with the local OB, and or with the local like in-hospital team at a hospital in the case that there is a transfer. So again, I encourage you to kind of look at the AABC website to look at what it takes to become an accredited birth center. Some positives of a freestanding birth center environment are really just the midwifery model of care and that continuity of care. Often, again, birth work is unpredictable, so often birth workers in general work in call groups, including in a freestanding birth center environment. However, it may only be 2 or 3 midwives and, you know, a couple of doulas, and you will get to meet them throughout your prenatal care. They really focus on that. So when you show up in labor, you've seen this person, you've seen the doula who's the birth assistant, you really feel like you know these people, and that continuity goes a huge way in terms of facilitating trust and peace in your birth. Furthermore, the home-like environment with birth centers is amazing. You feel like you're in the comfort of your own home, but you're not. And you have that added benefit of having these people there to support you that are trained in labor, but you're not within the confines of a hospital and under all the policies and procedures therein. Because you're giving birth with midwives and you have a low risk pregnancy and you're not in the hospital setting, there's minimal interventions. There's just space for labor and birth to happen. And I think that's something that a lot of people find to be a positive. Some negatives of freestanding birth centers are lack of immediate access to an operating room or to the NICU and special baby teams. Again, as I mentioned in the hospital portion, most low-risk normal pregnancies and births do not require immediate access to the operating room, okay, or to a NICU or special baby team. When I say immediate access, I mean within 7 to 10 minutes. Very rare do you need that for a normal pregnancy and a normal birth, full-term baby, etc. So although that immediate access is rare, I think a lot of people still are concerned about the what ifs, what happens if I'm one of the very small percentage that needs that immediate access. And I encourage you, if you're considering giving birth in out of hospital setting in general, home or birth center, talk with your providers about what their emergency transfer policy is and look how close you are to the nearest hospital to kind of go over those concerns. Another perceived negative is to not have the option of pharmacologic pain control. Again, when I say pharmacologic, I mean drug-based, medication-based pain control. That would be things like epidurals, IV pain medication. Freestanding birth centers and continuous labor support with midwives and doulas, there's a lot of evidence and data on how that decreases perception of pain in labor and increases comfort. Doulas, midwives, we're trained in a lot of specific non-pharmacological pain control methods. That's like use of hydrotherapy, whether it be a tub or a shower. There's things called TENS units, which are electrostimulating machines that can help control labor pain. There's a lot of breathing techniques, massages, acupressure. There's a lot of things that we can do. However, we don't have access out of hospital to larger medication-based pain control options, which can be perceived as a negative for some people. The last big negative, I will say, is again the insurance piece. Many people might struggle to have their freestanding birth center birth paid for by their insurance. If you're considering a birth center birth, I encourage you to look at your insurance. Some do cover it if it is provided by a nurse midwife and it's an accredited birth center. Some don't, in which case you would have to pay an out-of-pocket fee. Generally, that fee is much less than a hospital bill would be. However, it still might be more to you out of pocket than it would be in a hospital setting. So I would say, that insurance piece is one of the largest negatives and barriers to people being able to seek out birth center births. And that's unfortunate. All right, that was part 2 of my Place of Birth series, all about freestanding birth centers. I hope you enjoyed it. I hope you learned a lot. Please click on the next video to hear part 3 and learn about home birth. All right, see you soon. Bye.